Hello, this is Dr. David Green, Educational Director for Premier Pain Specialists in Chicago. Today's topic is what you need to know about occipital nerve blocks. An occipital block is an injection of numbing medicine that goes next to the occipital nerves. These nerves are located on either side of the scalp, originating at the neck. There is both a greater and a lesser occipital nerve, and either one of those can produce pain. Neither one has a motor function, meaning they only produce sensation. So you don't have to worry about stopping some sort of a motor function, like moving your head or whatnot. So the injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, and possibly migraines. It serves both a diagnostic and a therapeutic purpose. So symptoms of occipital neuralgia may include pain in one or both sides of the head, a tenderness to the scalp, possibly an aching, burning, or throbbing pain. And some patients describe it as a sharp or electrical shock in the back part of the neck and head. So who benefits from an occipital block? As mentioned, those who have occipital neuralgia. Could be those who have pain on one side of the back of the head that benefit the most. Those who are suffering from migraines, which is over 10% of the population. Cervicogenic headaches, by definition, are any headache that's caused by the neck, and that's usually a one-sided phenomenon. And then cluster headaches, which are one of the most painful headache types. So it's a quick procedure. It can be done in the office in just a few minutes. There's no need for sedation. The pain doctor will feel the point of maximal tenderness at the base of the skull, and the doctor will then move the needle to inject both areas, so almost like a fanning technique with either numbing medicine and possibly some steroid as well. So how well does it work? For such a quick, low-risk procedure, it works really, really well. Usually patients get pain relief within minutes. For cervicogenic headaches, studies show 50 to 90% response rate, which is good for well over 2 months. For cluster headaches, it's an 85% response rate, which can last up to 4 months. Occipital neuralgia, 85% response rate for 1 to 2 months. And then migraine, 60% response rate, averaging 4 to 5 weeks. So what happens when the pain relief wears off? What's next for the patient? Well, a repeat procedure can work very well. Could be every 4 to 5 weeks, could be every 2 to 4 months, or a patient could go on to have a radio frequency ablation, which you can see here in this cartoon. The catheter goes in, it gets heated up with thermal energy, and it can deaden those sensory nerve endings, otherwise known as the occipital nerves. There's no motor function, so you're not going to, once again, hurt a person's ability to move their head, okay? Also, this needle does not go in the spinal canal, so you're nowhere close to that. So it's a very low-risk procedure. Small studies have shown these to work really well. Looking at the risks of the procedure, they are minimal. There's some risk of slight bleeding, infection, possibly an allergic reaction to medication. The needle is outside the spinal canal, so these are not motor nerves. There's no risk of CSF leak or spinal cord injury. Some would have to be way off track for that to happen. The top non-operative pain management in Chicago is with Premier Pain Specialists. There are several clinics throughout the metro area, accepting over 50 insurances and providing over 25 treatment options with the board-certified fellowship-trained providers. Visit us online at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you for watching.